Hi guys, so this is just going to be a short video tonight about cardiovascular work, aerobic exercise. I just wanted to tell you what I think about it, how it should be done. I'm not massive on high intensity cardio, which I know a lot of people are nowadays. Now, I'm not saying there's anything bad about it, but if you're lifting weights and you're training very, very hard, I think high intensity cardio as well is just too much. You have to burn into some muscle tissue if you're constantly fatigued and you're doing, really, really hard, intense cardio. We don't have two systems, unfortunately. People fall into that trap. They think it's a completely different recovery basis from weight training to cardio. We're one system, we're one person. So you're recovering from everything that you're doing. So if you're training very, very hard on weights and then doing very, very intense cardio, one is going to affect the other, particularly when it comes to the weights. So personally for me, I've always done more of a steady state type cardio if I was getting ready for contests or getting people ready for contests. If I ever used anything a bit more intense than that, it might be just at, say, over a 30-minute session on the treadmill or something. Every 5 minutes I might throw in a slightly more intense, faster paced incline walk, just to raise the heart rate and everything a little bit more, and then take it back down to what I was doing. But most of the time it's just a steady state, constantly. Now, I know people say that you're going to burn into muscle tissue if you're doing that too often, too long and things now, but there's every study in the world coming out now. Let's face it, if you go back to the 90s, there were nobody in better shape than bodybuilders back then, and everybody did steady state cardio then. Everybody did fasted cardio then, which they're now saying is the wrong thing to do as well. So that's by the by, we can talk about that at a later date. But if you're training very, very hard on weights, I would certainly start out by doing steady state cardio if you feel that you need to, you're going to do a competition, and it's one of those things as well. I wouldn't necessarily recommend it year round because your body can not become accustomed to it as such, but you want it to know something's going on differently once the competition prep starts. And again, you're eating into your recovery ability, so use it as a tool when it's required, not all the time. If you do decide to do it year round for health benefits and things, I get that, but again, don't be doing hours and hours a day, that's just crazy. So if you are going to do it, I would, if we say competition as a starting point, I would probably do maybe 3 times a week for about half an hour, 20 minutes, half an hour. Start there, see what happens with that. If you're going to walk on a treadmill as an example, just start with it flat. But it wants to be a slightly quicker walking pace than you're used to. You can feel your heart rate go up a little bit of a light sweat. That's pretty much it. We can, if you want us to do that, let us know. We can give you exact numbers of heart rates and things for age and such, but I would start there, see how that goes. Obviously, if you're getting ready for a contest, it can become that you're doing it every day. Some people do it twice a day. But again, do what's required. What a lot of people do is they'll jump in 6-7 days a week and can't maintain it, or it'll work quite well, but where do you go from there if you've already started at 7 days a week? So start, with a really small amount, increase the time and increase the frequency if need be over time, and see exactly how you go with that. It doesn't really matter what you're doing to a degree. Walking is one of the absolute best. Do it outside, do it on a treadmill, do it however you want. If it becomes that you're doing, say, 45 minutes to an hour of it, and you're kind of not losing the effect as such, but you're not getting what you want, you may need to then maybe, on a treadmill as an example, raise it up slightly on an incline. That's okay to do. Again, it's not going to tap into your recovery way too much, that, because when you're on an incline or something like that, it's more concentric that you're doing rather than eccentric, which is going to damage the muscles more. So we really don't want to get into that too much. Again, we're using it as a tool for body fat. We're not using it for anything else. It's going to improve your heart function, all those things, obviously blood pressure, but we're not doing it to get super fit and things like that. Trust me, when people say bodybuilders aren't fit, if you're training in a high intensity manner for, say, 20 reps on a set of squats, you're not going to be unfit if you're doing that, because if you try it, oxygen debt and everything is unbelievable at that point. Your heart rate will be sky high, and you will get fitter. So just try that, try the steady state, and implement it how you wish to do that. But like I say, start at the least possible and increase it as you go along. If you did a treadmill, again as an example, there's loads of other things, steppers, so forth, but if you did start flat, increase the incline over time if you wish to do that. But again, it should still remain steady state. You shouldn't be feeling loads of agony in your legs, and be ready to fall off it by the end. That's not what it's about. We're trying to tap into those fat stores, not burn up the muscle and everything else. Doing cardio time-wise, I still think first thing on a morning fasted is still a good idea. I don't believe it burns up loads of muscle tissue. If you're worried about that, have something like a small protein shake or a few aminos or something before you do it, which you could do after training as well. I don't particularly like cardio immediately after training because I think you're confusing the body. You've just tore muscle tissue down for your body to rebuild it, and suddenly now we're doing cardiovascular work. It kind of gets a bit of a skew whiff of what's going on, and your body does work like that, whatever anybody says, trust me. So if you have to do it like that, try and get on immediately after weights. I certainly wouldn't do it before. I know a lot say do it before now, but you want as much glycogen inside you as possible for the weights, and when you do some cardio, you're still going to tap into some glycogen stores at some point, particularly if you started with it. So by doing the weights first, at least you've got maximum glycogen storage to get you through the weights, which is the most important factor, then finish with your cardio at the end. And again, you could do a similar thing when you finish the weights, a few aminos, small protein shake or something, and straight onto the cardio. So that's kind of how I would do it. Let us know what you think about that. If we can help you in any way with that, we will. But that's just my point of view. I know a lot of people will disagree, but again, I'm looking at the recovery ability that you've got, and too many people do so much that they're basically not getting anything at all because the body's just constantly exhausted and doesn't know which way to go. So hit the weights as hard as you can, within reason obviously, not to a point of overtraining, and then steady state cardio if you need it, and implement that over time to see where you go, and certainly try and have periods throughout the year where you probably don't do any at all, or if you do, a couple of times a week, 3 times a week max for 20 minutes or something, just to keep things ticking over. Because again, if you ever did decide to do a competition, you want the body to notice the difference when you start implementing more of it in there. Okay, so that's my thoughts on cardio. Let us know what you think. I hope you enjoyed the video, and we'll see you again soon. Thank you.